Hello everyone, thank you for joining us today. Today we are going to discuss the role of genetics and how that plays a role in your personalized healthcare. Personalized medicine is transforming the way we provide medical care to all individuals. Now we are able to cater your individual treatment to who you are as a person, and that has to do with genetic testing. So we'll dive into this a little bit deeper. By utilizing genetics, we can risk assess an individual. We can look at what your risk factors are to develop certain diseases, and we can also look at how to manage those diseases earlier, and we can cater that treatment to make sure that your treatment is catered towards you, where you may have less side effects and be able to tolerate medications better because of your own genetic makeup. Here at Family and Aesthetics Medical Centers, we have a few ways that we utilize genetics for our individual patients. One of the ways that we utilize genetic testing is we do a cheek swab that can actually screen for certain medical conditions, from cardiac conditions, which are heart disease, as well as pulmonary conditions. So our staff will come into the room, they'll do a little Q-tip to swab your cheek, and then that'll give us some information and insight about what risk you have or what diseases you are more prone to. Another way that we utilize genetics is that it can help and cater your treatment options. So a lot of times individuals come into a doctor's office and we diagnose you with a certain condition. And then there's a gamut of medications that we can use to treat that particular condition. Let's take anxiety, for example. There are multiple anxiety medications out there, but which one is right for you? Well, our genetic test will help us to know that. And that way, instead of us picking from a plethora of medications, we'll be able to say, which medicine are you able to metabolize? Well, if you can metabolize it, that means that that medication is going to go to its intended purpose and give you the results that you're looking for. And then it'll also tell me which medicines to avoid. Well, that's really helpful because one of the reasons that we don't like medications is because we are afraid of side effects. Well, if I cannot metabolize it, that means that I'm more likely to have side effects from it. So in this way, instead of us doing trial by fire, we're able to look at you as an individual. We'll get a list of the medications that your body can actually metabolize, and we'll also get a list of medications that we should not use in you. This will help no matter where you are seen in the country or in the world, because this will not change since it's part of your genetic makeup. Another way we use genetic testing is that we can look at which medicines you are metabolizing. Well, that's by a urine test. So I'll know if that blood pressure medication that I give you, if your body is actually metabolizing it, that diabetes medication, that pain medication, and we're able to look and say, is this the right medication for this patient? Is their body utilizing it the way that they're supposed to and excreting it the way they're supposed to? Or should I make an adjustment in your treatment? Utilizing this information now helps us to keep patients safe, to avoid damages to things like kidneys and your liver, and to help guide your treatment so you as an individual have the best opportunity to have the best health care and utilize the right treatment for you. So if you're interested in this new wave of technology and making sure that when you see a doctor, it is catered towards you as an individual, come and see us. Ask about the genetic testing and how we're utilizing this new technology to provide the best health care for you. Give us a call here at Family and Aesthetics Medical Centers, 832-619-1669, or drop in and ask our staff about it today. See you soon.